The Ministry of Health, Wellness and Elderly Affairs has done the assessment of the health needs of the population in general. Based on the population density of the various health regions, the mobility profile, and the proximity to hospitals and other significant infrastructure. At present, the physical public health infrastructure is divided into 5 levels of care. The Level 5 facilities include the Millennium Heights Medical Complex and the St. Jude Hospital. The Level 4 facilities include the Wells Urban Polyclinic, the Dennery Hospital, the Soufriere Hospital, and the new Dr. Betty Wells Urban Polyclinic located at the Dr. Winston C. Paris Medical Complex, the former Victoria Hospital. Each polyclinic or community hospital provides clinical support to the wellness centers ranging from Level 1 to Level 3. Our public health system has a distinct advantage of a network of 33 wellness centers situated within 3 miles of the various communities. This facilitates the provision of primary care services, including preventative care, island-wide. The Ministry of Health, through the Health System Strengthening Project, is strengthening the primary care services. This is the most cost-effective intervention in health. The Ministry of Health is working towards the establishment and strengthening of strategically placed emergency and urgent care facilities, providing extended hours of services with basic diagnostic services to improve access to timely, quality, and equitable health services. These services will be delivered through the Wells Urban Polyclinic, the Dr. Betty Wells Urban Polyclinic, the Dennery Hospital, the Soufriere Hospital, and the Viewfort Wellness Center. This should reduce the number of patients accessing the emergency rooms at the St. Jude Hospital and the Millennium Heights Medical Complex for non-emergency care. Centers of excellence are also being developed to provide a wider range of health services at community wellness centers across the island. With the increasing health needs placed on the Castries health facilities and the increased population numbers and urban center, the existing structures are limited in providing the expansion that is needed at this point and in the future. We've also noted the overutilization of the emergency room of the Millennium Heights Medical Complex for non-emergency cases, leading to long waiting times, delayed care, and frequent bed shortage. Presently, there is the need for extended operating hours of the Dr. Betty Wells Urban Polyclinic up to midnight, which will include weekends and holidays, to facilitate urgent care with basic diagnostic laboratory and radiology services. Establishing the Dr. Betty Wells Urban Polyclinic required increased resources, including human resources, equipment, and other supplies. As of December 16, 2024, with the rollout of the first phase of the Dr. Betty Wells Urban Polyclinic, clients can access a range of services. The National Eye Clinic will be providing general eye services, diabetic retinopathy screening, and laser treatment Monday through Friday from 8 a.m. to 4 p.m. General medical clinics, diabetic and hypertensive clinics, management of minor wounds, dressing services, urgent care, and pharmacy services will be provided daily, including Saturdays, Sundays, and holidays from 8 a.m. to midnight. In the second phase in 2025, the services to be available at the Dr. Betty Wells Urban Polyclinic include antenatal and postnatal clinics, child health clinics, family planning clinics, cancer screening, HIV testing and counseling, and home visits. In addition to the basic package of services, the Urban Polyclinic will also provide adolescent health and men's health clinics, physical activity programs, reproductive health clinics, hearing health services, daily dental services, nutrition services, community mental health services, counseling services, specialist clinics from visiting consultants as required. The Ministry of Health would like to thank the public and healthcare workers for their patience and support during this time. We encourage the public to utilize the health facility closest to them. The Ministry of Health will continue to strengthen health services across the island to ensure access to quality health care for all.